With the back pain, my life was absolutely at a standstill. Before, where I could dance, I could go to work, I could do the kickboxing or rock wall climb, to absolutely nothing in bed. I couldn't get up myself, I couldn't dress myself or do my hair. I had to have somebody in my family help me at all times. That's devastating for such an independent person.
Hi, honey. How you doing?
I watched my daughter and my husband give up their lives to help me because I couldn't even walk to the bathroom by myself. This was a very dark time for me.
Kelly Kilroy is like many millions of Americans who suffer from chronic back pain. Her pain was due to an accident she had the previous year. Chronic pain affects an estimated 16 million American adults and costs the nation up to $12 billion per year in medical treatment and lost productivity. Pain can totally change the way you live, and when it becomes too severe, it can stop you from living the life you love. Many people turn to prescription medications, but they can have side effects and even become habit-forming. Many people undergo traditional surgery, but this can be invasive, risky, and may not stop the pain. In the last few decades, another category appeared called minimally invasive spine surgery, or MISS. This allows surgeons to perform many spinal procedures through skin punctures or incisions less than 1 inch long. Recently, an entirely new, more versatile, and even less invasive technology for minimally invasive surgery is emerging through a group of partner physicians with North American Spine. They are pioneering a next-generation solution called the Accuroscope procedure. Several research studies published, such as the Journal of Neurosurgical Review, found that this procedure goes beyond traditional minimally invasive surgery. It is provided by only one company in the United States and has been shown to have an 82% success rate, which is significantly higher than outcomes associated with many traditional back surgeries. The Accuroscope procedure is one of the least invasive surgical options to relieve chronic back pain. The Accuroscope procedure inserts a catheter with 2 tubes through the natural spine opening, allowing the catheter free movement to multiple areas of the spine. One tube contains an endoscopic fiber optic scope or camera, and the other holds a laser. The high-definition camera allows the physician to literally see what is causing the pain and to treat it right then.
The difference in the Accuroscope procedure as compared to other minimally invasive spine surgery techniques is that the Accuroscope approaches the spine horizontally rather than vertically. In other words, we are able to enter the spinal canal through a 3 millimeter incision, and horizontally we're able to treat all levels of the lumbar spine.
Kelly tried many different solutions during the year after her accident to relieve the chronic back pain. Nothing made a difference.
I kept trying to go somewhere else. I kept trying one more doctor, one more hospital center, and they all wanted the same thing. They all wanted, here's pain management, here's the medications.
During the Accuroscope procedure, the unique way that physicians access the spinal canal allows physicians to treat multiple levels of the spine at one time with only a 3 millimeter incision. This gives the surgeon more versatility than traditional minimally invasive surgery that can only treat one area at a time.
Through this use of this catheter that has both a camera and a laser in the end of the device, we're able to access and treat impingements of the spine and the radicular nerves at all levels, and we're able to do that in one procedure.
Many conditions can cause chronic back pain, including bulging or herniated discs, spinal stenosis, degenerative disc disease, scar tissue, free fragments, and nerve root inflammation. North American Spine is an advocate for patients that works exclusively with physicians trained in the Accuroscope procedure.
We make a very small incision right here.
They bring the patient to the doctor who practices medicine and helps people understand what's available in the technology today.
Also take care of those.
Kelly tried to relieve her chronic back pain, first with a multitude of prescribed medications and various types of physical therapy. She also tried pain management techniques. This all resulted in little to no relief. Finally, after many frustrating attempts to stop her chronic back pain, she found what she'd been looking for in the Accuroscope procedure.
I was watching a television show. On it, they showed this procedure called a Accuroscope, and I watched. They were depicting a spine injury that looked like mine.
The traditional way to diagnose chronic back pain is usually through an MRI. However, this does not always identify pain and can sometimes pick up conditions that are not normal but are not causing the pain.
The diagnostic value of the Accuroscope procedure is that we are seeing in real time, high definition color, the symptomatic issues of the patient. The MRI and X-rays, CAT scans, other tests are relegated to a black and white, shadowy image of what could be the problem. In surgery, diagnosis is the critical issue. It is the most important thing. And so therefore, being able to diagnose and treat simultaneously, the Accuroscope has a tremendous advantage over other procedures.
First thing I noticed when I woke up after the procedure was my husband, my daughter, and the attending nurse. They gave me a sip of water, asked me how I felt. There was no pressure. There was no pain. And once they knew I had my legs under me and I was free from the anesthesia, it was time to stand up. My husband walked down the hall and said, "Come to me." And I walked to my husband for the first time in 7 months. It took my breath away. I'll never forget that day.
Many people try to live with their back pain every day, using a variety of techniques to cope. The Accuroscope procedure opens up an entirely new category of minimally invasive treatment that may be the solution to finally relieve someone's chronic back pain.
From the patient's perspective, recovery is very unique with this procedure in that we are not severing any supporting tissues such as muscles, ligaments, and tendons. We're only going in through that natural opening at the base of the spine. So many of our patients wake up and they're pain-free.
If I had to say anything about what my life is now compared to before the Accuroscope procedure, it's like night and day.
The physicians working with North American Spine are the only physicians trained in the Accuroscope procedure. It is an advancement in spine care technology. It gives people with chronic pain an entirely new solution that may help them get their lives back.
I have my life back. My husband has his wife and partner back, and my kids have their mom back. I'm ready to take the world on.
To learn more about North American Spine and the Accuroscope procedure, call 877-311-6791 or visit www.spinecareleader.com.